Fundamentally, skin of a child is different from an adult. They have a thinner skin surface, they have less melanin, but they lose water very quickly to the environment compared to an adult. So, we first and foremost important thing I would like to address to everybody is that you can use their products, they cannot use yours. So, you have to opt for products that are meant for use of children. Let's start with cleansing. Traditionally, we Indians have been scrubbers, and hot water bath is a traditional practice of giving bath to young children as it is believed it makes them sleep better. But I say against it. You have to make sure that the bath of your child is, probably using 4 to 5 mugs of water or half tub of water. You should not be using soap in a liberal amount. You should be using as minimal soap as possible. Always, number 3, always use a coconut oil before you give bath to your child. When it comes to the best oil, it is coconut oil, as studies have proven that not only it helps in retaining the moisture, it also has anti-inflammatory and antioxidant properties. Olive oil, mustard oil, almond oil, and all other oils that are used sometimes in India can be harmful for your child, especially if the child is prone for eczema. It is very important that you use a gentle cleanser for your kid and not use harsh alkaline pH or adult soaps. It is very important you do not scrub your child either with hand or soap or towel. Number 4, make sure that the amount of time spent in water is less, as kids tend to enjoy playing in water, but we'll have to find a smart way to make sure that they're not in the water tub for a very long period of time, especially if they have dry skin. It's very important for you to understand how to apply moisturizer for a child. Number 1, always warm your hands before you start putting the cream. Number 2, never forget to apply moisturizer in 3 folds of your child's body: behind the ear, the fold of your elbow, behind the knee. Number 4, make sure that the moisturizer that you choose is resembling the physiologic or the natural moisturizing factor. That is, it is rich in ceramides. Also make sure that you choose cotton or linen over synthetic garments. You should avoid using too much of woolen or fur containing clothes with your child, especially if they are prone for dryness and itching. Coming to the area of diaper, the diaper area care, it's important for you to follow ABC. A, whenever you wash your child's bum, you should air dry. B, apply a barrier cream and do not attempt to rub or clean that barrier cream. C, you should use a cream which is resembling a natural moisturizer, preferably a ceramide containing. And D, it's important for you to change the diaper every 4 to 6 hours. I'm also against the use of pant style diapers. You should preferably use a stick-on diaper compared to pant shaped diapers. So on an average, cleaning your child less, moisturizing twice a day, avoiding harsh alkaline soaps, scrubbing. And in that matter, I would also like to say the traditional bathing practices like using basin, turmeric or abrasive powders is not going to make the skin of the child lighter. It's going to worsen eczema, it's going to worsen dry skin, hence compounding the problem. There are certain clues that I would like to put forward when it comes to infections in children. If there are ring form shaped lesions, especially in the folds of the child, it could be fungal. As fungal infections are on the rise, increasingly we do see tiny toddlers coming with ring shaped lesions. If the child has oozing, crusted lesions or lesions which look like insect bites, your child could be suffering from a condition known as atopic dermatitis. Number 3, if your child has a pus-like boil or sometimes it may look like honey-colored crust, it could be a bacterial infection known as impetigo. Number 4, we increasingly see patients and rather parents running anxiously to us, child with fever, and there are red colored marks on palms and soles, a common infection known as hand, foot, and mouth disease, which looks very alarming but doesn't pose any danger to your child. Number 5, if your child has a patch on the hair which is crusted, scaly, or there are matted hairs, it could be a fungal infection on the head. So, besides these common infections, we see most of the patients with eczema, which can present in many forms apart from the images that are very popular on the internet. So, it could be a classical oozing, crusted type of lesions. It could be just, some signals like uneven skin tone, wrinkling under the eye. Then there are pinpoint shaped lesions. It could also present like insect bite. So commonly it is misdiagnosed by the pediatricians as insect bite, whereas it is a form of atopic dermatitis. It's time for you to see your dermatologist, especially to avoid usage of drugs which contain high potency steroids or those anti-infective agents for which we do not have enough evidence to be used in children. So if you think your child is not doing well with daily skin care and you see any of these signs and symptoms, I would recommend you see a dermatologist before starting any treatment in form of a topical or an oral drug.
Book an appointment with a cosmetologist or a dermatologist in your area. Please visit www.skinandhairacademy.in.